And welcome back to the show. Healthfirst recently announced it will offer its first Medicare Advantage Preferred Provider Organization plan for 2023. Now, the plan is designed to provide Medicare beneficiaries the flexibility to receive coverage for out-of-network care or to choose the lower cost option of receiving care from Healthfirst's extensive network of in-network physicians and providers. And joining us now to share more details, we're pleased to have the Senior Vice President of Medicare Healthfirst, Jen Cohen Smith. And Jen, good to have you.
Hi, Darren. It's great to be here. Thank you.
Thank you. And so got some things happening here, huh?
We do. We're excited for this year's annual election period, where we're offering the new PPO product among many other very strong product offerings in the Bronx and throughout New York.
Well, I want to talk a little bit about Medicare for a minute because we hear the word Medicare, and I just want to get some clarity for our viewers. For starters, talk to us about eligibility requirements and who's actually eligible to receive Medicare.
Yeah, thank you. There are about 200,000 seniors in the Bronx who are eligible for Medicare, and it's generally for people who are age 65 and over, although younger people with disabilities or people with end-stage renal disease can also be eligible for Medicare.
And there also are various components to Medicare, I know. So what are some of the various components that we have that are out there?
Yeah, it can be confusing or overwhelming because it's a little bit of an alphabet soup, literally. So Medicare Part A is what we call hospital insurance, and it covers inpatient hospital stays, care in skilled nursing facilities, hospice care, and some home health care. Medicare Part B is the medical insurance, and it covers certain doctor services, outpatient care, medical supplies. Those two together are oftentimes called Original Medicare. Now, in addition to Parts A and Part B, you can also choose to buy a Medicare Part D, which helps cover pharmacy costs. And then combine all of those, and we have Medicare Part C, which is what we call, we call Medicare Advantage, which is health insurance offered by private health insurance companies like Healthfirst, which at a minimum offers all of the things covered under Parts A and B, but also typically covers many other things like hearing, vision, dental. You can get over-the-counter monies. A host of additional benefits could be available to you.
And you use the optimum word choose, and I know that people are having the opportunity to make their choice as this is what's called the open enrollment period. For someone who doesn't know about open enrollment, how does that work?
Yeah, so actually the annual election period comes first, and that's October 15th to December 7th. And then following that is an open enrollment period. So annual election period is a great time for people to either join, drop, or change their Medicare Advantage plans. And it can feel overwhelming because I know your mailboxes are probably full with flyers from all of the different health plans, but there are some really important things to think about during this time. If you're already enrolled in a Medicare Advantage plan, you will have received an annual notice of change document, or you can get it off of your health plan's website. And this will make clear to you the changes to your benefits from 2022 to 2023. So any plan you choose now will be effective January 1st of 23. And it's also a good time to think about how your health needs may have changed, and are there other health plans out there that are better for you? And Darren, I also want to call out, there are 60% of people who are eligible for healthcare subsidies using them in New York, things that can save seniors thousands and thousands of dollars, whether enrolling in Medicaid that can make you eligible for incredible products like our Life Improvement Plan, where you have zero premiums, zero deductibles, and in 2023, zero copays on all tier levels of your pharmaceuticals, or whether you're eligible for a Medicare supplemental plan, which can save you $170 a month on your Part B premium and make you eligible for what is called extra help that can help pay for your Part D premiums. So please use this time to see if you're eligible for any of these subsidies and enroll in them. We can help you do that. Medicare Rights Center and other organizations can help you do that, but please use this time and then see what new products that might make you available for.
And Jen, I know also for Health First, this is an opportunity for you to have some unique offerings that are available to the public. So again, for our public that's out there that's watching, let's go over some of those unique offerings that you have.
Thank you. Could talk all day about Healthfirst's unique offerings. We're very proud of what we're putting out in the market in 2023. So we have the PPO product, which is brand new for us in 23. And as you mentioned at our opening here, it's a product that allows members the peace of mind ability to go outside of the provider network if they want to do so. Folks who are traveling to Florida specifically can have in-network benefits when they're in Florida, and they would be using out-of-network benefits anywhere else in the country. We also, though, have a really incredible HMO product. Both of these are under the Signature brand for people who know they're not going out of the network, right? They see that all of their doctors are in Health First's very broad and expansive network, appreciating that there is always global universal, global emergency and urgent care benefits, and don't need the ability to go out of network and would instead rather have some richer benefits, lower specialists in primary care copays, availability of a over-the-counter card and things like that. But Darren, we're also very excited for people who are eligible for the subsidies that we talked about is our life improvement plan and our increased benefits plan. And we've made some really exciting changes to those to make healthcare even more affordable and easy to use in 2023.
This could be an overwhelming process. And I mean, just, digesting the information, getting it myself as a layperson, I'm like, wow, okay, it's a lot to really consider, a lot to really think about. And for the person that's out there right now that has to make that choice and to really choose, they want to make the best possible choice. So what are some of the things that a person should be thinking about, considering, bringing into mind when they're making a choice such as this?
Yeah, it can feel overwhelming. And I think the most important things to do are to make a list of the prescription drugs you're taking today, make a list of the doctors and care providers that you are seeing today. And then when you're considering Medicare Advantage plans, find out where those drugs and where those doctors are in the network. Are they in network? Are the drugs free or do they have copays? Things like that will impact your financial out-of-pocket liability. Also, just take into consideration your lifestyle. Are you traveling a lot? Is hearing, vision, and are hearing and vision or other things really important to you? Do you want a gym membership, right? So just think about your lifestyle and then find a trusted advisor, or you can visit some websites to help you, kind of wade through all of the choices and find the best selection for you.
Yeah. And so I take it that this is a busy time of year for you?
Yes, very busy, which we always like. We have an incredible team of sales folks out in the streets. You probably see Health First tents everywhere, mobile units everywhere. We have 2 community offices, one in Morris Heights and one in Fordham. And we're constantly having existing members coming through just to say hi or to better understand their benefits, and new prospects coming in every day, new folks who we hope we can help take advantage of our amazing benefits.
Well, Jen, you broke it down a lot for us today. I want to thank you so much for joining us. And hopefully during this period, we'll see more people take advantage. I know you said there's so many people that leave it on the table, but hopefully by watching this, they'll be able to take advantage.
I hope so. And we're here to help. We're here to help you enroll in all the subsidies available to you, and then in the Health First plan that's best for you. Thank you, Darren.
And thank you, Jen. She's the Senior Vice President of Medicare at Health First, and that's Jen Cohen Smith. Well, now, if you want more information, we encourage you to visit the website at healthfirst.org, and then also hfmedicarelearnmore.org. We do have more show. We encourage you don't go anywhere because Open is continuing right after this.